Okay, well, thank you so much. Thank you, Marisa, for the kind introduction, Aliyah, Harry, and all of you that are present here. It's really an honor to be here with you. And I think I'm very excited about what's coming up and the importance of the work that we can do in global health. So as Marisa mentioned, I've been the director of the Global Health Institute for 1 year, about a year and a half. And my idea is to take the Wisconsin idea out of Wisconsin. That's what I'd like to see. I think we all are familiar with the Wisconsin idea. But I think at the same time, I feel like we're very humble. We are people that are very modest, but we are doing great things. And I want to show some other places, some of the great work that we can do. So starting by this, I think if you can see the slides and you can see my screen, we have a very unique here in Wisconsin. There's not many schools in the US that have this variety of programs all in one campus. I think we're very unique because we have about 21 schools and colleges, and you can see, you can walk across the street and you are in School of Education, you are in social sciences, anthropology, engineering, science. So that provides such a unique environment where we can really excel and do really well. And many of you, or many of us, know that Wisconsin is considered one of the top universities in the US, about in terms of research funding, it's one of the top 10 and brings more than $8 billion a year in research funding. But also I like to encourage a little more diversity. I think what we need to do is also improve that diversity and bring international students to Wisconsin. I think that's something that I think is very unique, because once we see the quality of the work that we do here, we think we can do work that can have more impact in different locations. So that's where I feel like I'm very fortunate to be the director of the Global Health Institute. And I can feel with that, I can bring many different players into action and listen to people, listen to different organizations, different schools and colleges that bring knowledge to global health. And to global health, we just went through a major COVID pandemic, and we can see the impact that infectious diseases and all these issues of vaccine access, knowledge, misinformation, and so on can have at the global health and global impact. Okay, so we also see that global health in general has what we call multidisciplinary impact. You see here 2 examples. You see the issue of COVID-19, for example, and climate change. Those are the 2 examples I like to use. And you can see how these 2 aspects of global health that are happening, today, have impact in many different areas: environment, policy and management, society, and community, and how these issues have even broader impact in many. So by working in just one single topic, we're not going to solve this. I think what we need to do is bring a different approach to solve global health issues, where it's not just medical science, providing more medicine, more drugs. If folks don't know how to use that medicine, or the medicine is wrong how to use the medicine, we're not going to be able to succeed there. So sometimes water, so we might solve issues by having a water filtration system, and that might actually involve some engineering that can provide us some different methods to have clean water. So my view is that we need to have a different approach, which are already there, to approach global health issues. Here are 3 examples of different approaches to global health, which you probably have heard of this. You have planetary health, is the health of the planet. Eco-health deals with the ecosystems and balance between ecosystems and health. Okay? And the One Health, the one concept that I like to bring to your attention that has been around for a long time. This concept actually has some roots in Wisconsin. There is a professor called Aldo Leopold, and you might have heard of the Leopold Foundation, Parabu, that actually, for a while, he mentioned that, this is about that lack of balance between the environment and human beings. So the concept of One Health has been changing for a while. And I'd like to explain it here kind of in simple terms. It's been initially that we need to have healthy ecosystems, healthy animals, and healthy individuals. That's basically the bottom line. How do we have that balance between healthy ecosystems, healthy individuals, healthy animals. But together, we need to have different mechanisms to do this. And one is communications, different collaboration, coordination, and capacity building. And you bring sectors and disciplines, either from environmental sciences, human sciences, animal sciences, that bring that knowledge. And then in society, we have different areas, either the local or the regional level, that can bring them together. So that's where I also think that the One Health concept, we can do really well in terms of global health issues. And also when we take a look at One Health in Wisconsin, you can see that in many different areas where we define in our group, we have an advisory group, and sorry, I went too far. We have here what we've defined, what are the major areas where we think that we should focus our work in Wisconsin. Okay? And you can see emerging infections is the major one. We just went through COVID-19, but there are many other pathogens that are happening there where human and animals, play a major role as well. We have the human, animal, plant health, was not just only about human, but also plant health. If we don't have healthy crops, we don't have healthy food, and we don't have healthy animals, so then basically that balance is not there. We need to have also social, cultural, and economic. There is so many parts, even here in the US, but around the world, this is a major issue where these things are fragmented or broken. We also need food, water, and energy security. More than 1 million people a year has no water, has no drinkable water, of lack of food security. And obviously, we see this every day. We see on a day like today, we are enjoying a nice winter day in February, but there's definitely the impact of climate change. And the land use is also a major issue because we also, as we are doing different things in producing more crops and so on, we don't have a really good system how we are using some of the land. So those are the major areas where I think Wisconsin has expertise that might have impact in different areas of global health around the world. And this is the area where I'd like to invite you to think about how do we interact together? How do we do different things? How the Global Health Institute can excel and help you? And I'm going to show you a little about what is some of our strategies. And if you see in the list that we have here, in many of these different units, we have school of colleges and campus that can really have a significant, and they actually have a lot of knowledge. They have a lot of work that they're doing in this area. So my idea is to bring all this together. So I think what this happens, many folks from many different anthropology, social sciences, education, medical science, we can work together. So to do this, I started by changing a little bit of the philosophy of the Global Health Institute and how we structure. I don't know how much you know about the past of the Global Health Institute. It has been for about 10, 12 years. It started in the medical sciences, as you can imagine, trying to have an impact in global health and medical sciences. And for a while was really instrumental in establishing educational programs in UW-Madison. We created educational programs with in the College of Agriculture and Life Sciences, where there is a global health major, which is actually one of the fastest growing majors in campus, with more than, I believe, 3,000. How many students, if you can tell me? 300?
Yeah.
Quite a bit, let's put it that way. But it's growing quite a bit, and it can be one of those areas where it attracts a lot of folks that you can see the potential there. Being involved with environmental science in the Nelson Institute, they do University, trying to understand more about climate change and the impact of climate change in big cities. The 4W, which is led by the Human Ecology, is Women, Wisconsin, Well-being in the World. That's the 4W. So those are really, really good programs. But what I want to do now is to have a different view and to have more research impact for the global health. So I report to the provost of UW, and I have board of visitors and advisory board, and I'm very fortunate to have here two members of our board of visitors and the work with us, and I hear their advice, good advice with frequency. And then in my team, I'm very fortunate. I have Kalina Krosky, which is the Associate Director for Partnership. And so she's my right and left hand. She listens to all my crazy ideas and then tries to implement them, what's happening. You are seeing Katie Newcomb, which is our Communications Director, and you can see the new vision that we have with Global Health. I encourage you to take this brochure. There are some brochures in the end, how we are trying to show what we want to do in terms of the Global Health Institute, and with different programs. There is undergrad programs that we are doing, summer internships and so on. And then to give a different flavor, we hired last summer John Chan, who is Associate Research Professor, that is going to work many different faculty across campus in grants that relate to global health, whether they're social sciences, medical science, engineering, and so on. And so that's actually, it's been quite busy submitting proposals and so on, but if any of your faculty has any interest anywhere in the world, we can work with you to bring together a proposal, and we look for opportunities. And if you know of a potential opportunity that we can work together, we'll be very happy to see that happening. We also are getting postdocs, so we receive a postdoc from the Global Virus Network, likely get a second postdoc in the near future. So what I see happening here is that we are little by little implementing a program where we can have research faculty in different units in campus working in issues that matter to all of us, and then we can bring all that together. So I'm very excited about that possibility, and that's what I like to see happen in the future. To do this, we also created different One Health centers around the world. So the one that I'm going to tell you more about is Colombia, but then also I'll be very excited about telling you about India and Africa, that we're doing in West Africa with different opportunities. What we have there, the model that we have is having a local partner at some of these locations. We have postdocs that are working in global health issues that matter to that particular region or that particular country. So we're trying to not to solve our problems, but to work together, trying to bring new approaches to important global health issues. The second approach there is to do capacity building. So get training graduate students that are here co-sponsored by local institutions with us. They can come here, they do some of their graduate work here, then they go back to their country to do their research programs. So that's something we're doing. And then also mentoring undergrads that can go and have the experience to understand what it's like to be there, to do science, to do work in that particular environment. We had a good success last year. We took 2 undergrad students that went to Colombia for 8 weeks. And we're going to continue doing this year and like to expand that to other locations that you will see in different parts of the world. Okay? So the other 2 places that we will mention will be India and West Africa. And I'm very excited about telling you about what we're thinking about West Africa as well. So the way that we like to do this is by promoting different One Health centers around the world. I think what is important for us to understand that what happens in other locations in the world can impact us. We are not isolated. We are connected. And so COVID-19 shows us the impact of something happening in different locations in the world, how that actually affected us. And that could happen any day, anytime. We live in a global economy. We have things that impact different locations in the world, and those things can come here anytime. We have issues with a disease called avian influenza. I don't know if you heard about this disease, but this is migratory birds can bring that disease here, and that gets into poultry in Wisconsin. I actually did last year, and that had significant impact. But we have a dairy industry that actually can be affected by what's called foot and mouth disease, a swine industry by African swine fever. So there are plenty of pathogens that can happen. And also with the crop industry, there are many pathogens that can come this way. So what I like to do with this model is basically have what we call One Health centers in different locations around the world, where faculty, students, postdocs can go there and understand what it's like to work there and to work in issues that affect that region and bring your knowledge. Okay? So to do this, we like to advance what we call UW research, but also U.S. industry, because also there should be a partnership between industry and academics. So that's what I like to encourage. Another idea for us is capacity building. So to do this, we need to provide training. I think we need to provide local training there, but also here, the capacity building. We need to do more pandemic preparedness. I feel like, yes, we might be better prepared for a future epidemic or pandemic, but we are not there yet. We still need to do more. Okay? If something happens today, are we ready? Are we prepared? Do we have diagnostics? We have access to vaccines. We have access to drugs in different parts of the world. I think we still have issues there. And global health security. I think overall the big picture is, we all have to play our role in global health security and contribute to this. So I think that's what we need to be a major part of that. In terms of education, so what I'd like to do is create programs for international students. I think we really are a great campus, but we need more diversity here. And I feel like there is importance for us to, bring students from many different locations in the world that have opportunities to have scholarships here, and then they can return to their country to work in some issues there. The international internships, as I mentioned, have opportunities for U.S. students that can really understand and see how science education and other issues happen in those countries. And also, eventually, we are not there yet, but in the future, we would like to have field courses for undergrad students that can go there for 4 to 8 weeks, and then basically work in those locations. So the example that I like to bring to here to your attention is Colombia. And I know Colombia is very far from Africa, but I think in fact, there is a lot of roots between Colombia and Africa, if you want to know the truth, okay? The music, Harry and I were talking about this. There's a lot of communities that we have where, we have heritage from Africa, and it comes in our culture, in our music, in our roots. We don't cook as good as you do, but we enjoy life as well. So what we have been doing in Colombia for a while is what I want to use as a model, and then from there work with you how we can build this in other parts of the world. Okay, so we have a different players here, and it is an academic institution, which is the National University in Colombia, which is pretty well established and has 9 campuses in different locations in the country. The government, so it's the Ministry of Science and Technology, which basically supports our initiative, and industry partner. Industry partner provides funds, and that sort of edge that we need sometimes for things to happen, so we don't have that sometimes. I don't know how familiar you are with Colombia, but basically we're in the top corner of South America. We have 5 nations in the border, and there's a lot of migration issues. You have seen a lot of the human migration. There was a seminar yesterday here about migration and coming to Colombia, and they come through the Darien Gap, they come to the US. But we also have indigenous populations, which are very unique as well. They're very highly vulnerable indigenous populations. We have a lot of biodiversity and a lot of fauna in the country. So that actually provides a really, perfect situation for emergence of infectious diseases, but also to work on a lot of the issues that we brought up as our mission. Food and water and energy security, social equity, and climate change as well, and the other ones. So here with these partners, we are now what we call part of this coalition that's called the Abbott Pandemic Defense Coalition. That basically these are about 20, now there are more than 20, about 25 sites around the world that we are working together to monitor emerging infectious diseases, trying to prevent the next pandemic. That's what we're working on. And this actually brings a really nice environment collaboration where we actually talk to each other. We train each other. We share news, share information, and we work together. So you can see here there is several sites in the Americas, but you can see also several sites in Africa, which is really, really great. And this also work with us in different capacity building. The site in Sierra Leone is also sponsored by Abbott, and we're going to have 2 more sites, one in Rwanda and one in Mexico. And they're also very supportive of all the different sites in Africa. So what we're trying to do here is basically take opportunities for UW faculty. And here's some examples, but there could be plenty more examples. This is what we have done in the first year to work in different areas that, UW faculty can have a major impact there. In climate change and infectious diseases, we have Professor Paul Black from the College of Engineering. Neglected diseases, Mustafa Semenian from the School of Veterinary Medicine, human microbiome. There was the talk yesterday by Sarah McKinnon about the safe passage from the Darien Gap. And then we also work with College of Engineering in health clinics, trying to use solar panels, solar bicycles, electric bicycles to electrify health centers or health posts in rural areas in the country. So this is just an example of what we can do. And the same model that we have here, like to bring that to different locations in Africa. So that's what we want to do in the future. We have a postdoctoral program, as I mentioned. So these are postdocs that are based in Colombia, that are working in different issues in Colombia, in the aspects that we mentioned in our mission. So we have postdocs working with Alberto Vargas in food security and sustainable agriculture, in genomic approaches to help soil-transmitted helminths, and also they use medicinal plants to treat vector-borne diseases. So that's really going well. And we also have a graduate student program that brings students from Colombia to do their PhD here. We have now 3 students. Leonor Hidalgo is doing in communications, and Daniel Maldonado is in biomedical sciences. An undergrad program where undergrads went to Colombia for last summer, and they actually spent 8 weeks there, and they was quite productive there. So that's the model that we have in Colombia, which is more advanced. I'd like to talk a few minutes about the model that we have in India as well, and then finalize with the work that we're doing in Africa. So if you can wait a little bit for Africa, so I just want to tell you about how excited we are, okay? So India is different. So you can think that this model works different in different parts because different parts of the world are quite different, right? So, and we also have to recognize the importance of Asia and Southeast Asia. In terms of everything that's happening in the world, it's a land of many contrasts, but also many opportunities. We see India has been, in terms of population, the largest country in the world right now. In terms of economy, it's the 5th largest economy in the world, now soon to be 4th, and so on and growing. So you can see the change that has happened there. So we have their champion, Dr. Chris Naela, that basically sponsored us to build what we call the One Health Center in India. He hosted us a year ago. We went with a large group from UW-Madison, about 17 of us went to India, went to Delhi, to Hyderabad, Pune. I went to Pune as well, and Bangalore, and really understand that the situation in India is quite different. We met with government officials, and what we see here, the impact that we can have is in vaccines and gene and cell therapy, taking work that's been done at UW-Madison. Faculty are doing great work in gene and cell therapy, and providing that as an opportunity to folks in India. Same thing with vaccines, because there is a lot of needs in terms of, for example, rabies vaccine in dogs. There is about 25 million stray dogs in India. There's about 50 cases of human rabies per day. That's huge. And you will think that, because we don't have that here, but it's really a significant problem there. So we need to work on those issues. And so working in general in pandemic preparedness, trying to do research development, trying to bring new opportunities to UW campus that we can do there, and opportunities for the students and for faculty as well. We are doing partnerships with different groups there. We have Biotech, which is the company from Dr. Chris Naela. Dr. Ella is a UW graduate and extremely successful now. He has more than 14 companies in India, but doing extremely well in both human and animal vaccines, but also developing partnerships with different folks in academia, in industry, and at the government. So that's the model that I see happening, where we need to have very strong partners. I think this is all about different partnerships in different areas as well. Okay, so now let's go to what we are thinking in Africa, and I'm very excited about Africa because, honestly, it's the complexity, which I don't have to tell you. The complexity of Africa is very large continent with more than 1.4 billion people. there is totally different regions and 55 countries, and so there is one single template that can fit it all. This is quite different. When I talk about Latin America, I find a lot of similarity between Mexico and Colombia and Chile, for example, which is very far from each other. If I go here between Sierra Leone and go to Ethiopia or Rwanda or South Africa, we're talking about two totally different things. So I appreciate the complexity, but I also appreciate the opportunity of doing this, because I think it's all about learning from that opportunity that we have. So we start with the 5 major areas that I mentioned, and within the first year that we have, we found support for emerging infectious diseases. It doesn't mean that the other ones are really important and we're going to get there, but little by little, we're going to build this. We're going to have programs in all these different areas in Africa as well. So the first part that we started is in West Africa. We wanted to start in a place where we felt like UW faculty has presence there. And I think that's critically important, because for us to go to a place, we need to understand the logistics, the locality, the complexity and everything locally, and build those partners. You have to build trust. And if you don't have trust, you don't go anywhere. So Professor Josie Kawaoka is a very well-known, respected scientist worldwide. He's a member of the National Academy of Science, and he works in West Africa. Peter Hartman is one of his mentors as well. And Hajin Dai is a UW that is present in Sierra Leone, has built connections in many different parts of the US, but also here in Wisconsin. So I think many of you know Al-Haji, and he has been here multiple times. So the idea here was to start with, we know Sierra Leone is a hotspot for emerging infectious diseases as well, and the Ebola outbreak has had a significant in 2014, many cases. So I think has the conditions for this to happen again. And we want to start with local capacity. So for that, we created a program to really take some of the stuff that we're doing in Colombia, monitoring acute febrile illness, and doing this surveillance in Freetown, a town about 1.3 million by hospitals there. And we have here a very similar model where we have industry partner. We have the government of Sierra Leone. We have a private group, this Project 108, but also here we have a partnership with Senegal, with RSF in Senegal, which actually can help us to really do capacity, because not everything is in place in Sierra Leone, so we need some support from the Diagnostic Institute in Senegal. So that's where we're starting in West Africa, but that doesn't mean that that's going to stay there. We want to explore other options and other opportunities and continue to build across Africa. So as I mentioned, it's quite diverse, and we're working with different faculty in different areas. Professor Nancy Kendall in Malawi, we'll talk about that in a minute. We're looking for a potential partnership there. We also created what we call the GHI Africa Interest Group, and we learned that UW faculty has projects in more than 20 countries. So it's the effort that we are doing individually is huge in Africa, but there is the opportunity here to bring all us together. Say, okay, can we share resources? Can we share information that you are doing? And that way we can help each other. We are also creating agreements and dialogue, especially in the dialogue with different universities in Africa, and then also working with industry and government. As you imagine, governments are quite different. There's different places. So we want to facilitate that dialogue, trying to understand the local government. It's critical for us, but also finding local partners. And we also have to support what we call the existing programs that there is in Malawi, in South Africa, and Rwanda, where we have some faculty there, and then trying to find how we support those programs, but also that it will become sustainable, that it can be programs that can be a long-term program. It's not just a program for a few months and so on, and then get out there. I think we need to create local capacity. So we have been talking to folks in different parts. from the National Public Health Institute in Liberia. They work here in Madison, trying to build partnerships there. We visit the Rwanda. We had a visit from the Rwanda Ministry of Health. We're going to talk about that in a minute. And Sierra Leone, Senegal, and Malawi as well, Rwanda. So with Professor Nancy Kendall in Malawi, we're working an NGO, IPECI, which is an Institute for Participatory Engagement, Quality, and Quality Improvement. And this program is just about to get going. We're actually in there for about a year. What we like to see here is happening, the opportunity to bring opportunities in terms of education, prevention, and different diseases and engagement, community engagement in Malawi. We're also doing different work at Stellenbosch University in Cape Town. We have different visits. First from the university, we went with the Wisconsin Alumni Research Foundation, with CALS, and a private company in Wisconsin Illumina. We had a visit there. We also hosted members for what's called the South African Medical Research Council, came in September last year. We are now exploring joint PhD programs, and that's some discussion that we're having. We are hoping to host a delegation from Stellenbosch that will come here later this spring semester, and we'll have a faculty from Stellenbosch that will be visiting, and will be our visiting faculty and the biochemistry department in the fall of this coming year. So I think this could be a great opportunity for us, for students, and to expand, and we're in the process of setting this up. With Rwanda, we're also meeting with the Health Minister of Rwanda. I think this was a meeting that had a great challenge when in October last year. We hosted a delegation from Rwanda in last fall, and we are developing some proposals with the School of Medicine and Public Health in terms of how you'll see that in a minute, how we're doing capacity training and education. And the other process with what's called the Susan Buffett Foundation, which has basically based in Kigali, in Rwanda. We already established with Abbott support health center, what's called acute febrile illness health centers in Rwanda, so that's going to take off. And we're establishing what we call the Center for Infectious Diseases Education and Training with the School of SMPH. So here is what actually, this is going to be led by Dr. Dashira here at the School of Medicine, with Dr. Raya Westergaard, which actually is the Chief Medical Officer, the State Epidemiologist for Communicable Diseases for the state of Wisconsin. He actually managed a lot of the information with the COVID-19 pandemic. He actually is going to do a sabbatical year in Rwanda, and other faculty are going to be there. So this is going to provide us a great opportunity to work on many different areas, including local capacity building, training different clinicians to understand infectious diseases, how actually get the basically a bigger view on training in terms of febrile illness, how we can manage this with the support of the medical school. In terms of education, we want to develop training in global infectious diseases, and this is something that we are going to apply for different grants to bring students from Rwanda and some other countries as well. And then in terms of research, try to do collaborations with GHI faculty to bring some of the 5 strategic areas that I mentioned, and see how can we work on these areas, and the students will go back to Rwanda or to some of those countries to implement their work, okay? So this is sort of like giving you a picture of what we are trying to do in terms of general views, but we also are trying to change our communication skills or practice or the strategy. We have, I don't know if you have had a chance, but we have what we call the Global Health Tuesday webinars. We just had one yesterday, which it was basically about global health funding. It was really well attended with people from the Gates Foundation and the Fogarty International Center. We plan to have one in March 19 about artificial intelligence and global health. So we are trying to have this big picture, how we can all have a major impact in global health. And then we'll have one in terms of policy making and global health. And then in April 10, We plan to have our global health symposium. This is something that happens every year, so we like to do this year. We'd like to invite you to attend, also to submit abstracts if you like to be there. We'll have a poster section, and then we'll have an area where we can all interact and discuss topics, and this could be a great opportunity for us to explore different opportunities and collaborations. So I'm getting close to my end, because I know Harry is going to tell me when it's about 40, right? So, but the idea here is that we want to expand the Wisconsin idea worldwide. You know, I think we want to bring opportunities for the faculty, for the staff, for the students, that you can collaborate globally, you know, with different communities, with industry, find partners in different locations. And these partnerships really can bring a lot of good to a lot of us. You know, I think that we can build a better world. You know, I think what we can do with the knowledge that, with the capacity that we have in Wisconsin, we can do things better. We also want to have access to UW technology. And I think it's amazing to see WRF, you know, the capacity that WRF has and the research that happens at the University of Wisconsin. But does that research have global impact? You know, when sometimes we don't see those, that technology being applied in Sierra Leone or being applied in Malaysia or many locations. So we want to have that opportunity there. Also, by doing this, I think we can support local and global economies. I think by doing this capacity building, we bring the education level and we bring opportunities for local economy to grow. Need to increase diversity and equity. You know, I think we need to change a lot of this as well. And this is the first step that I like to see happening, how we, you know, bring folks from different cultures, get to know each other better, and try to, you know, improve our equity here as well. We like to address social issues that are related to One Health, and I think we can do all of this. And also, you know, we need to detect pathogens before they become a major issue. So by having this One Health Center in this location, we can actually be part of this national or international network that can actually, you know, see these signs of warning, say, you know, something is happening here, and we should pay attention to this. Yeah. And then we definitely, I can see that we can create a safer world. You know, I think we can, you know, not only work in this, but then basically have all these different issues about global health, majority impact. So my idea here is just the call for action that we connect. You know, I think here we are opening doors to have a dialogue with you, any of your faculty that are interested in interacting with us, students. Please, so if you see any opportunities on any of these locations, it doesn't have to be in Africa, but if any of your students is interested to work with us, please so, and then we can find a potential partnership with us. And it's all about network. I think for me, it's very important for us. How do we network with each other? By working individually, we don't have the solutions to the problems I think we need. So with that, I just wanted to thank you for your time, and I'm open to any questions you might have.
Well, thank you for such a rich presentation, and I hope that lots of us can see many ways to connect with the really important work that you're doing. So, questions? Yes.
In Rwanda, did you work on the health of human beings, migrants that the British had deported from UK?
We have not yet established the program in Rwanda, but I think, so what you bring up is the different aspects of human medicine, social science that have an impact there, you know. So again, what we want to do is bring like the One Health approach, you know, that basically has different components, social issues, human issues, and all these issues that would be important. We'll be working with the partnership with the universities in Rwanda, the University of Rwanda, the government of Rwanda, and a local NGO. That's what we plan to work on.
Thank you so much for your insight. And I think you are doing a very significant job. And it is equally exciting listening to the Colombian experience and also India. I'm from West Africa, and we used to have the highest rate of death compared to other regions. in the continent. And also there have been a lot of projects, global projects, which were introduced in different countries. However, the issue of sustainability has always been a problem, or continuity. So I was wondering, how can global health strategies be adapted to effectively address Africa's distinctive challenges with infectious diseases? Although you have mentioned capacity building, we used to have a lot of capacity building, especially the country that I come from, the Gambia. However, health has always been a major problem in West Africa.
Yeah, thank you for your question. I think when I visited Sierra Leone, Senegal, some of those countries, you can see a lot that happened that they're grown sort of thing, with all respect, that the Westerners come to those countries, do the work, take their samples, and then they leave, okay? And leave the mess behind. So I feel that that's the grown approach to do things. And when I went to, to Sierra Leone, there was so much effort put into Sierra Leone through the Ebola, outbreak and so on. And it's disappointing to see what is left behind. There is no local capacity. There is no one that can do a major, there is no capacity period, and the infrastructure, same way. So I think our approach needs to be different. That's how I see it happening. I think what I see our model is probably more working from bottom up, trying to start with understanding like the same model that I did in Colombia, trying to have local folks that are trained to work with local scientists to work on local issues, having a different approach to solve global health issues in that location. And then from there on, start building, in my opinion, little by little. But I do agree with you that what we have done so far basically has not worked. I feel like there has to be a different approach. And it's very unfortunate to see what has happened in the past. So, and then also you mentioned the difference between different countries. It's really amazing to see that as well. What I see happening here is that we don't have to replicate everything in every country, perhaps. What I think we can do is support each other. Like if Gambia, Senegal, and Sierra Leone and Niger can share resources, we can perhaps do something different to do this. In my field, for example, having a very nicely equipped laboratory costs a lot of money. To support the laboratory actually costs more. So what happens in many of these, and this is what's happened post-COVID-19, many of these places started to build their own facility. And it looks really good at the beginning, but to sustain and to support that is a difficult issue. So what I'm more interested in is in regional work, trying to build networking in those regions. So with Al-Haji and Jai, we're working with Senegal and working with Liberia and some other locations to build more network. And that's what I see happening in some of the other countries as well, because I see for now that a single country does not have the answers to everything that we can do there. Yeah.
Yeah, thank you very much. I understand that kind of things you get with researchers, governments, and industry. So I'm wondering if you have a kind of outreach, kind of social, cultural, and economic engagement activities that you do to connect with the local communities. I think that there are important aspects and programs that you do. So I wanted to have those kind of things that talk to them about their programs and maybe their role in how you can achieve those goals. Thank you.
Yeah, thank you. Yes, we do through a local partner. So in many of these countries, we have a local NGO or a local university, a local partner, which actually is very engaged with the community. The case of Malawi with IPECI, in Sierra Leone actually was the example that was used trying to understand the Ebola, the culture of dealing with death and how by community engagement, you could break some of that culture to stop the spread of diseases. So And it's really critical for us to understand the local culture and local community. So yes, that's part of the plan and the goal. With the PECI, for example, just provide you a clear example, that's happening. And some of the other countries we have, every country is unique in their own sense of culture, how you do that, but having a local partnership is critical to do what you request.
So I'll pick up from my two colleagues there. So, part of the challenge, as you said, even, with the complexities of Africa and opportunities, is also recognizing that there's a lot of silo work that's done both on the continent and also even here at the university.
Mm-hmm.
So it was interesting running into someone who has done a lot of work, in a part of the region that I'm from, and I'm like, I have no idea who you are.
Mm-hmm.
And so my question is actually about here.
Yeah.
What are you doing to talk about Nancy Kendall?
Yeah.
What is, apart from, telling people come to us?
Yeah.
Are there things that?
Yeah, like this, we are reaching out, right? And I think this is part of my strategy. I feel like, with all respect, we're kind of disconnected a lot of things from many different units in campus. And that's how, unfortunately, campus is, We are very disconnected folks and different groups of people. So I think my idea with the Global Health Institute and see from our advisory board is to reach out to as many folks in different parts of campus that we can. And that's also important for me. I was in my lab hidden for 20 years. That I was very happy doing my own work there, but I learned that that's not the solution to everything. And if I want to have impact, I want to do this, I need to be here. I need to meet you. I need to go to social science. I need to go to education, different folks, and also getting myself out of the comfort zone. And that's what I'm trying to do. But so also to tell you that I don't have the solution for everything. And I think what I want is us to work together to try to see how we can do this better. I think UW will have a significant impact. When I look at many other schools across the US, they don't have what we have. They don't have the potential that we have. But we need to work together, And we are always hear about this, Johns Hopkins, Harvard, and so on, but they don't have this. And I think we can do a major impact. But we need to work together. We also need to really send the message that global health matters. Okay, I think sometimes we don't get that it matters because we have a pandemic, and then that's gone, and we will go back to normal, and we continue our lives. But I think we need to show that actually this matters. And the issues that I mentioned, social equity, food, water, and energy security, are important globally. I mean, we're a public land university, and we're very focused on the state of Wisconsin and people of Wisconsin. But we also need to think, abroad and beyond Wisconsin and beyond the US. That's what I see that happening. Okay.
Can I ask you a question about sort of professional skills that serve you in doing this kind of international networking? So, I mean, we've got undergraduate students and grad students and faculty, many of whom want to work internationally or do work internationally, but what are the skills that serve you in doing this kind of work and that have allowed you to be able to make these kinds of connections across, the academy, within the academy, across the academy, with industry and government?
I think the number one skill is to be willing to listen. I think sometimes we are not good at that, but also I mentioned being out of our comfort zone. And for many of our faculty that are international, we have done some of that, but I think at the same time is to understand that the work that you do here can have significant impact somewhere else, okay? Yes, I mean, it's great, and we all, as faculty, maybe worried so much about our tenure and what we want to get here and our publication here and our record here, because this every day you hear this, right? I gotta get tenure, right? Otherwise I'm out of here, right? And I see you smiling there, so that's probably music to your ears. But what if you don't worry about that? What if you worry about the impact that you can have with your work, And then many of those doors will open. And my situation, I I grew up in Colombia, so I learned that, my work needs to have significant impact. And actually, I have to tell you a personal story. My mother is the one that actually pushed me because she said, what are those degrees? You have all these degrees, but there are people still dying here from dengue, So she pushed me to really get myself out of my comfort zone and say, well, you need to study something better. You need to do something better with your life, So that's the message for you. I think sometimes we worry too much about our day by day, about the paper, the class, or so on. But what if we think bigger? What if we think that we can actually have an impact? So I think those skills, we all have it. I think the fact that we are here because we are eager to learn. We really are, and to teach at the same time. So I think my invitation is to the faculty, to the students, to get yourself out of the comfort zone and see that there's great opportunities out there.
Any other questions? No? Do we wrap up there? Yeah,
Thank you so very much.
happy birthday.